Hey everybody, Ingra Sparkman here from Southbridge Street Live, and I just wanted to let you guys know that we have banded together with CASA, Golden Crescent CASA of Victoria, for their annual backpack drive. Now I know it's summertime, so this is a crazy time to be thinking about school, but for organizations like CASA, they need to gather materials and supplies for children all year long. So this is it for the next couple of weeks on Southbridge Live. You're going to see that some of my guests will be bringing in backpacks themselves. If you also would like to donate a backpack or school supplies, you can come by our studio at 1102 North William Street, or you can call me at 361-649-1825, and I'll be happy to come by, pick up backpacks and supplies to help support our local Golden Crescent CASA. Everybody, and welcome to another edition of Southbridge Street Live. It is my absolute honor to introduce, this is Professor W of UHV. He is Assistant Professor of Health Studies. And you're here today to talk about a program, the Victoria Alliance Against Chronic Kidney Disease.
Yes, I am, and thank you very much for allowing me to come in here to talk. I am blessed to be here. This is a great scenery in order for me to promote the program. Cool. So yes, I am promoting the Chronic Kidney Disease Prevention Program.
All right, just tell me everything about this program.
Oh, this is a program, this is a free community program for Blue Cross and Blue Shield in which we are targeting individuals that might be at risk for chronic kidney disease.
Okay.
And so the two biggest risk factors are people who have diabetes or people who suffer from hypertension or people who are at risk for either one of those. Now, you don't necessarily have to be diagnosed with hypertension or diabetes. You could be someone who's in perfect health or seemingly good health who is concerned about potentially they could be at risk for that due to genetics or just they want to keep themselves healthy. So this is the program that is geared towards them. It's a free program.
Wow. Yes, tell me, okay, so here are, so you're really right now looking for participants, and your next event is coming up in July?
Yes, ma'am, July 17th.
17th?
It's going to be at the UHV campus at the North Building.
Wonderful.
And it's usually from 5 to 7. And this is a program in which participants will come to the sessions. It'll be an educational session in which they'll get information, they'll get promotional information, educational information. We'll also be screening them. We'll be screening them for diabetes on a monthly basis. We'll do hypertension. Initially, we'll also have them do a urine test. Look to see if there's any proteins in their urine sample. And there's also going to be incentives. We're offering, our participants Fitbits. So they can keep track of their physical activity because we're going to have a physical activity plan in which they're going to be using, which they're going to partake in. And we're also going to be creating a nutrition plan. We have a nutritionist on board who'll be working with us.
Oh, that's phenomenal.
Yes, this is actually a community coalition in which we have various individuals that are working with us. We have a Sam Jarrett, who's a nutritionist, local area nutritionist. We have nurse practitioners, Carrie Pillar and Chris Steins that are working with us.
Oh, yes.
Yes. They've been gracious enough to devote their time. We also have a personal trainer who's actually one of my students, Brandon Cantu. We also have nephrology associates, Dr. Khan and Dr. Kumar, who've been nice enough to devote their time to our program.
How long will this study, for participants, how long will they be actively involved in the study?
For right now, it's at the end until December, but we're hoping possibly, there's no promises, but we're hoping that we can actually extend the program further until sometime until next year, hopefully, if all things go well.
So how prominent is kidney disease and high blood pressure and type 2 diabetes?
Well, kidney disease is actually the 9th leading cause of death in the United States. It's one of those diseases that unfortunately doesn't get a lot of focus on. Because usually when we talk about deaths, we're usually looking at people dying from heart disease, people dying from cancer, COPD. Unfortunately, kidney disease is not one of those things that we mention.
Can we talk about that for a few minutes?
Sure.
So what are some of the signs of chronic kidney disease?
A lot of times there isn't signs to the initial stages of chronic kidney disease. Your kidney malfunctioning may occur and you may not know your kidneys are not healthy. So a lot of times there is no, there are no signs and symptoms to it. A lot of times. Sometimes people will report suffering abdominal pain, maybe blood in their urine, painful urination. You know, those are sometimes the signs and symptoms, but a lot of times there are no signs and symptoms, especially when the kidneys start to disintegrate.
Wow.
Yes.
Now, is there a correlation between high blood pressure, type 2 diabetes with this chronic kidney disease?
Yes. Diabetes is a number one risk factor for chronic kidney disease, and hypertension is number 2.
Oh, wow.
So those are the 2 biggest risks. There's also other things like genetics that may play a part, certain kidney diseases that may cause chronic kidney disease, but those are the 2 biggest risk factors for chronic kidney disease.
So what would a participant look like for someone who, you know, agrees to be a participant or is chosen? So let me see, what kind of screening do you have these participants go through?
Anybody who's above the age of 18.
Okay.
This is a open, you know, program for all those individuals that believe they're at risk. We have people as young in their 20s all the way to people in their 80s that are part of it. Male, female, you know, race, it doesn't matter.
Right.
It's all open to everybody of all socioeconomic status, so it's open to everybody.
So let's say I was a participant that qualified. So what would my week look like as being someone who is a test subject for?
We would ask you to come to our biweekly sessions.
Okay.
We do know that that's not necessarily always, you know, possible, because some people, you know, work, some people have family issues and family problems.
Things come up. Life
comes up. Things come up for me. Life comes up for me out of the blue.
Yes.
So we ask them at least once a month, preferably twice a month, because we feel the more you learn, the better. Right now, we're in the beginning phases of creating a nutrition plan and also a physical plan, physical fitness plan. And so hopefully, once we get those set, individuals that have those plans will start to, you know, engage in those plans. And so while they're away from the educational sessions, hopefully they'll be working out, or at least doing what they can physical fitness wise, and also nutrition wise, and watching what they eat.
So, but coming to you bi-weekly, is that a specific time in the evening, during the day, or is it is at their convenience?
From 5 to 7.
From 5 to 7.
Yeah,
okay,
the
so
UHC
twice a week. Come 5 to 7.
Twice a month. Yes.
Twice a month. Oh, I'm so sorry.
No,
twice
it's
a
okay.
month.
It's
Thank
fine.
you
It's
very
fine.
much.
It's
twice
fine.
a month. That's awesome.
Yes,
and
ma'am.
then 100 participants will be selected.
100 participants. We're right now in 65 and 70, so we still have slots open for anybody. It's a free program, so we want to be able to, you know, reiterate that.
It's a free program, but you get a Fitbit.
You get a possible Fitbit, a portion mate. We even give HEB gift cards on a monthly basis. Yes.
Yeah, for these.
$25 gift card. And we're hoping that people actually use the gift card and actually buy healthy foods with it.
Too bad you can make that a stipulation on your card.
Well, we try much as we can.
Yes, that's right.
We're not looking for people to buy booze or cigarettes.
Sure, there you go. Well, what do you think is, you know, how is our community as a whole looking like as far as, you know, are we a healthy community? Are we relatively unhealthy? Because I've heard lots of statistics that say that we're relatively unhealthy.
We are relatively unhealthy when we compare ourselves with other counties. We're not the lowest county-wise. There are lower counties, but when we compare ourselves on average on certain things like diabetes, we're actually a little lower. You know, we do worse than on average compared to other Texas counties.
So this is a concern truly in our community.
It is a concern. It's actually a concern throughout the country, to be honest with you. It's something that is not talked about enough, chronic kidney disease. And so it's not only a Texas thing, it's actually a country thing.
Right,
US
absolutely.
thing.
Would you be able to answer what are 3 things that most people don't know about kidney disease?
Well, I mean, most people don't know that it could possibly be a silent killer.
Right.
People who have hypertension or diabetes at risk for it.
Okay.
And it is really a painful way to die. If you were to get chronic kidney disease, you maybe have what's called end-stage renal failure, in which your kidneys don't work, and then you would have to go on dialysis or get a kidney transplant. Even then, your life is going to be limited compared to someone who hasn't gone through that.
Okay, I have something for you.
Sure.
Do people who go through dialysis, is it true that that is one thing that our nation, for people who do have to go undergo dialysis, that it's paid for by?
It's actually, yes, it's covered under, Medicaid, Medicare. Yeah, it's covered.
So
it's covered. End-stage
something...
renal failure is covered, yes.
Well, I thought that was really interesting that that one of our past presidents felt that this was really important, that Americans were able to receive dialysis.
Right.
And so it's one of those programs, one of those medicines or treatments that are actually paid for by the government, which I thought was interesting.
If you're at end-stage renal failure.
If you're in end-stage renal failure. I just found that fascinating, that there was something like that. Now, it does say that the benefits are a customized physical activity plan, that you cook and prepare healthy foods.
No, I don't cook and perform healthy foods. Anyone who's ever tasted my cooking, who's lived to taste my cooking, I don't do it myself. But yeah, we have somebody who does that.
The benefits of participation, and then free educational materials and tools. So kind of give me a little bit about you, because I'm, as a biographer, of course, I'm so interested. So as assistant professor of health studies.
Yes.
So how many health studies have you participated and spearheaded and put together?
What do you mean?
So in health studies, to give me an example of what the definition of health studies is.
Okay, well, health studies is we're actually looking to help prepare students who want to become professionals in public health and community health or in allied health. We have students that may want to get into occupational therapy or physical therapy that also use that.
I'm so naive. I thought you meant that you are the assistant professor for just a second there of health studies, meaning that any studies that are coming in about, disease or, issues.
Oh, no, I'm the professor of the curriculum of health studies.
The entire, gotcha. Curriculum of health studies.
Ma'am.
Well, that makes sense.
Yes. Oh, it's okay.
Is this the first time that you have helped to spearhead something like this?
Yes, in this area, yes.
Wow, that's fascinating. What have you done previously?
Well, I've mostly done more research.
Research-based,
in other universities. And so, this is the first time I've actually spearheaded a community grant. And so we're excited about this thing taking off. And
absolutely.
Yes.
Absolutely. Now, will you do something like this again later on in the year? Are you looking forward
we might, depending on the success of this, we might actually expand this.
Oh, wow.
To cover more areas in Texas, depending on how well this goes. That's all contingent on how well this goes. There might be other community, grants I'll work on. There's more things going on than chronic kidney disease. And so this, hopefully this will be the impetus, this will be the starting point for future, effective grants in other areas.
Yes. Is this the first time that UHV has received a grant like this?
From Blue Cross and Blue Shield Texas, it is.
Oh, wow.
Yes.
That's absolutely fascinating. Will students in any way be participating or reading any of the materials or any of the findings?
We actually have a student who's working with us. Her name is Gail, and she's working with us on this program.
Wonderful.
But we have to get that information published.
Sure.
And so we might actually, after everything is done, actually get this published in a journal.
That's what I was just fixing to ask you. Will your results be published anywhere?
Hopefully, if everything goes well and I write a good enough journal
that's awesome.
that'll be all. Yes, ma'am.
Well, this is very, very cool. So, so you are looking still for participants. Your next event, where you will do a screening, basically, where residents now, do they have to be residents of Victoria County? Can they be out of county, or do they need to be?
We prefer to be county, but if they're from surrounding counties and they're willing to come in, we're not going to deny them.
Sure.
We'll take them.
Yeah,
also.
if they're willing to come
if
in
they're
for
willing
the
to
twice
come
a month
in,
and
if they're willing to come
in
and get screened, we will take them.
Do you feel like chronic kidney disease is, you had said it's kind of a silent killer? I mean, even in the pamphlets that you have, it says your kidneys keep you alive, so keep them alive.
Yes.
So here's what I was going to ask you. Tell me about prevention. What is the best type of prevention for chronic kidney disease?
Well, since hypertension and diabetes are usually the biggest risk factors, making sure you go to the physician, your primary care physician, being screened on a yearly basis.
Right. Is that part of a normal screening? When you go in for like a yearly exam?
It depends.
Okay.
If you go for a full exam, usually, but if you go in for like what do they call it? Modified exam, usually not. It depends.
So it really depends on an individual to create dialogue with their doctor.
Yeah, if you go for a full, if you go for a full physical, usually yes. Yes, urine samples are usually taken, and they do glucose screenings for your blood sugar levels. And, and they also look for hypertension, sees any signs of that. And so the risk factors for that is obviously nutrition, if possible, de-stress yourself. Stress can also add to that.
Really?
Yeah, because stress actually makes your heart work harder than it normally has to, especially at rest, which makes it more increasingly, risk. There's a bigger risk for hypertension.
Right.
Being physically active is another important component. If, like I said, if you have a family genetic component, then you want to get checked in an earlier stage, earlier age.
Yeah.
Yes, earlier age.
How common is it for kidney disease to carry over into generations?
Well, it's more common in those individuals that have a family member, especially immediate family, like a mother or father, than those who don't. So again, if you have a mother or father who has suffered from some kind of kidney disease, then it's highly, highly recommended that you seek medical advice on what to do next.
Tell me about how the funding, if you don't mind, because I just find this fascinating. Tell me how the funding works. It applies for the grant, but what does Blue Cross and Blue Shield, what is their interest, of course, is?
Their interest is obviously to promote healthy.
Right,
okay?
exactly.
They have a genuine interest in the health of individuals in Texas, and it also helps with costs. And so there's multiple reasons why Blue Cross and Blue Shield are involved. And so, I'm involved because I really want to see a betterment around the community. I think not only the university, but we individuals who work in healthcare can do more to help those around us.
What are some of the advice that you would give for healthy living?
For healthy living, work out, work out.
You're a fan of working out, sir?
I'm a fan of working out. I believe working out and watching what you eat.
Yes.
And so, I'm a big fan of
Well,
that.
will you do me a favor? If it's not against the HIPAA regulations, I'm sure it's written in a way that's not. Will you come back on the show and let us know what the findings were from
I would be more than happy to do that.
I think that would be fascinating.
If you're willing to have me on and stomach me again
Absolutely.
and tolerate me, then I would be more than happy to do it again.
Absolutely fantastic. So if you're interested in being a participant, whether you have a family history of chronic kidney disease, or if you have high blood pressure or not, or diabetes or not, you're going to be taking participants. As a sort of, a first come, first serve basis on July the 17th. Yes. At what time?
At 5 to 7.
5 to 7 p.m.
Like I said, we'll be accepting people before that.
Sure, absolutely. So, and I'll create some dialogue for you previously to them too. And where would they show up? They would meet at what time?
They would meet 5 o'clock in the multi-purpose room in the University North building on the UHV campus. The University North building is the first building that you see off of Ben Wilson Street.
And can I give them your email address?
Yes, please do.
Okay, all right. Here's why he's called Professor W. His last name is, it's spelled Wiblishauser.
Yes, ma'am.
Wonderful. And that's then the letter M for Mike. Or Michael at uhv.edu, so people can contact you there. Yes. Well, thank you so much, sir.
Well, thank you. I appreciate being on here. Hopefully, I'll be on here for other reasons.
Yeah, absolutely. And then again, absolutely, please come and talk to us about these findings. This. Wonderful. Well, thank you very much for your time this afternoon, and thank you all so much for watching South Bridge Street Live.
Thank you.